Hi everybody. In the last several videos we've been talking about Dr. Bredesen's ReCODE protocol for reversal of cognitive decline, which has been a crucial program for my dad. Dr. Bredesen's team has helped hundreds of people reverse their cognitive decline, establish mild cognitive impairment, and Alzheimer's disease with this protocol as evidenced in successful studies in 2014, 2016, 2018, 2022, and current clinical trials. Today we're continuing on with the Cognoscopy, Dr. Bredesen's diagnostic framework for screening all the potential contributors and risk factors for cognitive decline. All of these tests and lab results paint a clear picture of where a patient stands and helps identify how they got there. It is the foundation for an individualized protocol to be built out for prevention or reversal. On the last episode, we specifically talked about the very important lab marker, hemoglobin A1c. Next up, we're coming over to fasting insulin. So, what is fasting insulin? Fasting insulin refers to the level of insulin in our blood after we haven't eaten for a certain period, typically 8 to 12 hours. It is a key indicator of how well our bodies manage blood sugar and can be used to assess insulin resistance and diagnose conditions like type 2 diabetes. According to standard of care, you may walk into your doctor's office and any lab value between 2 and 25 micro IU per milliliter may put you in the normal range. But in reality, the NIH views any level beyond 9 to be considered prediabetes. And fasting insulin levels above 25 micro IU per milliliter, when seen in addition to high fasting glucose and hemoglobin A1c, levels typically signal diabetes. Now, there's no universal strict guideline for fasting insulin, and most experts prescribe our fasting insulin levels to be below 10 micro IU per milliliter. But Dr. Bredesen and his team have seen optimal cognitive health and function with levels below 4.5 micro IU per milliliter. This is the range Dr. Bredesen recommends for prevention and reversal of cognitive decline. Fasting insulin doesn't tell us everything, but it is a good marker for our overall metabolic health. And even if prediabetes or diabetes have not been diagnosed, if this marker is outside the optimal range, it typically points to the state that precedes these conditions, which is insulin resistance. For optimal cognitive health, we're going to need the opposite of that state. We're going to need insulin sensitivity. Dr. Bredesen considers reversing insulin resistance and restoring insulin sensitivity to generally be the most important factor in helping patients prevent and reverse cognitive decline. The reason? Majorly because insulin resistance leads to metabolic dysfunction, diminished cellular energy production, and inflammation. Our brains are especially sensitive to insulin resistance and this shortfall of energy, as they are on average only about 2% of our total body weight, but consume anywhere between 20 to 25% of our total daily energy intake. In fact, our brains can start to become insulin resistant before our lab markers start showing outside the normal ranges. Diminished energy supply for the brain leads to diminished cognitive function. There are good reasons and very good studies that demonstrate why Alzheimer's has more and more been referred to as type 3 diabetes. Dr. Bredesen regards high insulin and glucose to be two of the most important risk factors for Alzheimer's disease. The human body is not designed to process more than 15 grams per day of sugars, far less than the one soft drink, which has 40 to 100 grams, depending on the size of the drink, but our diets are laced with them, from sugary sodas to candy to sweet cereals and sweetened yogurts and even store-bought bread. When we eat foods with a high glycemic index, not just sugars, but also starchy foods like white bread, white rice, white potatoes, and baked goods, among others, our bodies pour out large amounts of insulin in an attempt to keep glucose levels in check, because the glucose itself is toxic at high levels. This harms our cells and neurons in several ways. Cells become insensitive to the constant flood of insulin and stop responding to it. This insulin resistance contributes to not only type 2 diabetes, fatty liver, and metabolic syndrome, but also to Alzheimer's disease. Insulin signaling is also one of the most important factors for the support of neuron survival. And in addition, the body degrades insulin after it does its job, escorting glucose into cells. It does this with, among other enzymes, one important one called IDE, insulin degrading enzyme. But IDE has another important responsibility as well. IDE also degrades amyloid beta. And if IDE is tied up degrading insulin, it isn't degrading amyloid beta. Amyloid levels therefore increase, creating a higher load of these sticky proteins that jam up communication between neurons and create chronic inflammation, contributing greatly to Alzheimer's development. Dr. Bredesen has found that insulin resistance is the single most important metabolic contributor to Alzheimer's disease. Here we go again. And that the biggest drivers of insulin resistance for us are diets high in simple carbohydrates such as sugar, processed food full of high fructose corn syrup, sedentary lifestyles, poor sleep, and chronic stress from work and home lives. But he also found that the antidote to reversing insulin resistance and restoring insulin sensitivity was optimizing the right diet, exercise, sleep, and stress management programs within patients' protocols. These are the core pillars of the ReCODE protocol. Again, Dr. Bredesen's optimal fasting insulin blood lab range is below 4.5 micro IU per milliliter. And the biggest lever in achieving this level of insulin sensitivity is what we eat every day. To learn more about this, please check out episode 16, linked on the screen and in the description below for a brief overview of Dr. Bredesen's anti-Alzheimer's diet. I've also linked all of Dr. Bredesen's recent studies in the description below. And I'd love to hear from you. Has your neurologist ever spoken to you about fasting insulin levels? What do you think of this video? Please drop me a comment. If you found this information helpful, please feel free to share this video with anyone you think it could serve. And please like and subscribe as it helps our community grow. And remember, I'm not a doctor. I don't have a PhD. I'm a caregiver and citizen researcher on the ground, helping a loved one, someone just like you. This information is for educational purposes only. Please consult your medical practitioner before implementing any changes. Thank you for watching. My dad thanks you. Hope these resources are helpful for you and your family. Thanks.